Thank you for joining us today for our Medicare Made Clear Zoom meeting. I know your schedules are busy, but we appreciate you taking time out of your schedule to be with us. So we're going to get started with the presentation. It's not working. Just a moment, please. So again, here at Storen Financial, we serve you in many capacities, and one of those is the Medicare Advisory Services. And our goal is to help individuals coming onto Medicare understand what options they have, as well as help those that are already on Medicare better understand their benefits and how they work. My name is Ruth Hoffman, and I have over 20 years of experience working in this field. And I'm an independent broker, so I am able to offer various plans. And that's important because we want to make sure we place you in a plan that's going to work best for your needs. And I am certified to sell the prescription drug plan, which is called the Part D, the Medicare Supplement Plan, and the Medicare Advantage Plan, which is called the C. I have a license in health and life, as well as P&C. So again, the consultation that we provide here at Storen Financial comes to you at no cost. We will evaluate how you're currently utilizing healthcare. Many times I'm going to ask you to share with me what medications are being prescribed to you that you take daily, because that's going to be important in assessing what your out-of-pocket obligation is going to be once you come on to Medicare with a drug plan. We're going to explain what options are available to you, and again, explain what financial responsibilities might be based on your final healthcare plan selection. So let's get started. It's called Getting to Know Medicare, and there's going to be a time when we're going to be presenting the different components of Medicare, and hopefully this will clarify some of the misconceptions that are out there and better educate you so that when you transition, you feel more confident. So the top 10 questions that we're going to touch on today is going to be: what is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? This is an important one. What does Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose a Medicare plan? When can I enroll? When can I change my coverage? And how can I save money? Okay, so what is Medicare? Well, Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you pay while working, and is individual health insurance. What it is not is free. It is not a family health plan, Social Security, or Medicaid. So again, you have to be a U.S. citizen or legal resident. More importantly, for a legal resident, you must have lived in the United States at least 5 years in a row, including the 5 years just before applying for Medicare. Typically, those that are eligible for Medicare are 65 and older. There are some that are younger than 65 that qualify due to a disability. And you qualify anytime you've been diagnosed with end-stage renal disease, or LIS, which is Lou Gehrig's disease. Do I need Medicare if I plan to work past 65? That's a very good question. I get this asked all the time. Generally, you can delay Medicare past age 65 without penalty if the employer has 20 or more employees and the employer health coverage is considered credible. You need to enroll at age 65 if it's a small employer with less than 20 employees and your coverage is not considered credible. Now, in regards to continuing to work past age 65, I would tell you, if you are in a high deductible plan in which you are contributing to an HSA, you do not want to take any part of Medicare, not Part A or Part B. If you do, then you have to discontinue your contribution to your HSA. So if you have any questions, talk to your HR department, or certainly give us a call here at Storen Financial, so that you can make sure you're moving in the right direction. What if I cover my spouse through my employer? Many times we are covering our younger spouse, and you may have to check with your employer to see what that consequence could be, especially if it's an employer with fewer than 20 employees. Okay, Medicare and your employer insurance can work together. If you take any part of Medicare, you will no longer be able to contribute to the HSA. That's real important. It's a health savings account. Your company contributes and you contribute as well. Medicare will not cover anyone but you, so consider how your dependents will be covered. So what does Medicare cover? There's two parts to original Medicare. There's the Part A, which is hospital insurance. It helps pay for hospital and inpatient care. And then Part B is medical insurance. It helps for doctor visit, outpatient services, anything, any service for which you are walking in and walking out for that appointment. Medicare A covers hospital stay and inpatient care, including your room and meals, care in special units such as the intensive care, prescribed drugs and medical supply while you are an inpatient. This includes lab tests, x-ray, and medical equipment, operating room recovery room services, skilled nursing, some blood transfusion, hospice care, including medications to manage your symptoms and pains, part-time skilled care for a homebound after a qualified inpatient stay, that's called home health care, and rehab services after a qualifying inpatient stay. And Medicare requires you to have a 3-day admission in order to be eligible for this rehab services. So that's an important thing to keep in mind. Some fast facts. The Part A hospital insurance premium is free if you or your spouse worked and paid taxes for 10 years or longer. You can't be denied coverage. Coverage is nationwide, including any qualified hospital in the US. Coverage and costs are per benefit period. So if you're admitted into a hospital, a benefit period is 1 to 60 days. You must be admitted as an inpatient, and that's real important to get defined when you're hospitalized, and that you're not being considered as being an observation status. And it provides 60 lifetime reserve days beyond your benefit. So what is Part B? Part B covers doctor visit and outpatient care, including, and I'm just going to touch on some of these, doctor visits, including when you are in the hospital, wellness visits, preventative services, and flu and pneumonia shots, anything that's a vaccine that currently is being covered under Medicare, labs, x-rays. There are some programs that are covered under the Part B, for example, a smoking cessation or obesity counseling, physical therapy, any of the therapies, diabetic screening, mental health, durable medical equipment, and ambulatory surgical centers and emergency room visits fall under Part B. Fast fact on Part B, there will be a monthly premium and it's adjusted for your income. So Medicare is going to look at 24 months prior to you coming onto Medicare. So let's say you come onto Medicare January 1st of this year. Medicare is going to look at your gross adjusted income for 2021, and they're going to base your premium on that data. You may want to go to Medicare.gov and Google what's called IRMMA. That's IRMMA. And it stands for Income Related Monthly Adjusted Amount. And depending whether you're a single person or a husband and wife filing taxes, there's certain categories that you fall into based on your gross adjusted income, and the premium is based on that. For Part B, you can't be denied. There's no medical underwriting. It is national coverage, including any provider who accepts Medicare. There are some premium penalties. unless you qualify for a special enrollment period, if you do not pick up Part B when you should. What Medicare doesn't cover, I'll touch on some of these. All the costs of your care, you have out-of-pocket costs with no limit. So Medicare does provide benefits under A and B, but there are deductibles and co-insurances that are your responsibility. Medicare does not cover prescription drug. That is handled under the Part D benefit. No routine dental, vision, or hearing, no eyewear, contacts, or hearing aids. Long-term or custodial care is not covered under Medicare. There are some physicians who do not accept Medicare assignment, and you would be responsible for what's called excess charges. And typically that's 15% more than what Medicare approves for that service. And if you travel outside of the United States, except in certain circumstances, Medicare does not deliver benefits. So if you're coming onto Medicare and you plan on traveling outside of the United States, I would highly recommend you pick up health insurance for that foreign travel so that you protect yourself from unforeseen medical crisis that happens outside of the United States. Where can I get more coverage? So there's really two options once you come on to Original Medicare. So you must have Original Medicare A and B, and you must be enrolled in both. So with option one, you can add one or both of the following to Original Medicare. You can add the prescription drug coverage under what's called the Part D plan. It helps you pay for prescriptions at the retail level. If you don't put this in place, then you don't have any coverage when you go to your local pharmacy. And more importantly, you will be assessed a late enrollment penalty when you do add it sometime down the road. The other option that you want to select, because Medicare does have out-of-pocket that will be your responsibility for deductibles and co-insurance, is to consider putting a Medicare supplement insurance plan in place, or what's called a Medigap policy. And those are offered by private insurance companies. And again, it's going to help pay some or all of your out-of-pocket costs that comes with Original Medicare. Now with option number two, you still have to be enrolled in Medicare Part A and Part B. You still have your Part B premium. When you select Part 2, you are selecting what's called a Medicare Advantage plan or a Part C. And those are offered by private insurance companies. And basically, when you are enrolled in a Medicare Advantage plan, it takes the place of Medicare for services under A and B. So that private insurance company will be responsible for delivering your Part A hospital insurance benefit, as well as Part B services as well. Many of these plans include the Part D embedded in the plan, and then they also offer some additional benefits like vision and dental. So a Part C Medicare Advantage plan is another way to get your Medicare benefits. An alternative to Original Medicare for benefits under A and B. Plan members are still in the Medicare program, but the benefits are administered by the private insurance company rather than Original Medicare. Plans are offered by private insurance company. Many of them offer the drug benefit embedded in them, and they do offer some additional benefits such as dental, vision, and a fitness membership. All Medicare Advantage plans cover all the benefits of Part A, except for hospice, which is covered under Original Medicare. They also cover all benefits that fall under Part B. And again, they offer prescription drug benefits. Medicare Advantage plans do offer some additional benefits. I've already touched on those, and you see them there on the right. Now with Part C Medicare Advantage plan, it is a plan that is going to deliver what's called coordinate care plans. There are several different types of coordinate care plans under the Part C. There are HMO plans, or what's called a health maintenance organization plan, or a PPO, which is called a preferred provider organization plan. There are plans that are called point of service. There are special needs plans for those that have both Medicare and Medicaid. And if you are institutionalized in a long-term care facility, they do have plans for those individuals. Other types of plans are called private fee-for-service plans, and there's another one called a medical savings account plan. So that's why it's important to work with someone who is knowledgeable about all the different options, so that if you consider enrolling in a Medicare Advantage plan, you select the one that's going to work best for your healthcare needs. Okay, some fast facts about the Medicare Advantage plan. Again, I want to stress that you have to be enrolled in Medicare Part A and Part B and continue to pay your Part B premium directly to Medicare. And you live in the service area that delivers that plan. You can't be denied coverage based on current financial or health status, including pre-existing. There's no questions regarding previous health history when you enroll in a Medicare Advantage plan. You may be required to use providers and pharmacy network. Coverage and costs vary by plan and may change each year. We're going into what's called the annual enrollment period. And right now that's going to be October 15th through December 7th. So if you're currently on Medicare and you want to talk about or think about considering making a change for January 1st, you want to get with a advisor to look at what options are available for 2024 between October 15th and December 7th. There are limits to your out-of-pocket exposure when you are enrolled in a Medicare Advantage plan. Some of these plans do have a premium. And again, you must continue to pay your Part B premium. I get this asked all of the time when I enroll someone in a Medicare Advantage plan. You know, why is Social Security still deducting my Part B premium? The reason that is so is because you have to be enrolled in A and B when you are in a Medicare Advantage plan. Let's talk about Medicare Part D, which is called the prescription drug coverage. There's two ways to get the benefit. You can have a standalone a standalone Part D plan, or it can be embedded in the Medicare Advantage plan. The Part D covers most commonly prescribed medications for beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in a drug list is called a formulary, and commercially available vaccines are not covered by Part B. So when you're making a determination to select a plan, whether it's a standalone drug plan or an Advantage plan, you want to share with your advisors which medications you're taking so that we can make certain that you're going to have great coverage and that you don't have to make a switch with what you're currently on because the plan does not cover your specific medication. This is very important. Okay, so let's talk about the formulary. And if you look to the right, you're going to see it goes from Tier 1 to Tier 5. And as we move from 1 to 5, you can see that these medications become increasingly more expensive. So drugs are grouped into tiers based on cost. In general, the lower the tier, the lower the cost, and deductibles may be charged by tier. Typically, when you look at medications in Tier 3, 4, or 5, there's an annual year deductible you have to satisfy before a benefit is delivered. Okay, so for this calendar year, this is 2023, there is an annual deductible of $505 with most prescription drug plans. Your initial benefit does not begin until that deductible's been satisfied, and then you will start out with $4,660 of total drug benefit. So whether you start January 1st or October 1st of this year, that is what you're allocated by the plan. Once that benefit has been depleted, you go into what's called the coverage gap or the donut hole. And that means that that amount is $7,400 out of pocket cost. Now, you're not there alone. You're there with the insurance company that's delivering the benefit, but your out of pocket cost will increase when you get into this phase. And then once that phase has been satisfied, you move into what's called catastrophic coverage till the end of the year. So depending on what stage you're in is going to determine how much you're going to pay for your prescription, and dollar limits can change each year. Not all plans have a deductible, and many people never reach the coverage gap or the donut hole. It's only if you're on very expensive medications, those that fall into tier 3, 4, or 5 will probably exhaust your initial coverage benefit and get you into the coverage gap. And again, if you do not utilize all of your initial coverage by the end of the year, it does not roll over. It starts with a new benefit. Again, fast facts about Part D, or the prescription drug coverage. For this one, you must be enrolled in Medicare A, B, or both. May be required to use pharmacy network. Coverage and costs vary by plans and may change each year, and they typically do. Part D premium penalties for late enrollment unless you qualify for a special election period or enrollment period. So what that means is if you come onto Medicare and you do not put a drug plan in place, and it's not offered through an employer or some other means, you will eventually be assessed a late enrollment penalty by Medicare when you do pick up a drug plan sometime down the road. Okay, let's talk about the Medicare supplement insurance plans, or what's called the Medigap. And that was under option number 1, where really it works with original Medicare. Medicare is going to pay first, and then the supplement will pay secondarily. Typically, when you are on original Medicare with a supplement plan, you want to add the Medicare Part D. Can't be used to pay for Medicare Advantage costs. You should not have a Medicare Advantage plan in place. It's either Medicare with a Medigap policy, or it's option number 2 with a Medicare Advantage plan. There's 10 plans standardized by federal and state law that you can select from. Plans are labeled by letters like A and G, and what costs and services are covered may vary by plans. Plans with the same letter offer the same benefits nationwide, and plans are offered by private insurance companies. So again, when you're on original Medicare with Part A and Part B, you're going to have out-of-pocket exposure when you use services in those categories, and having a Medicare supplement plan is a very wise idea so that you're not financially devastated. All right, so let's talk about the Medicare supplement insurance plan. What the plan does, Medicare is going to pay first, and then with the Part A hospitalization co-insurances, the Medigap policy for the premium you're paying will be picked up. It will also pick up skilled nursing facility care for rehabilitation. Under Part B, it covers the co-insurances and co-pays that you may have. It covers an additional 365 extra hospital days. And with us experiencing COVID a couple of years ago, this is a great benefit because they were very long hospital stays for folks that had COVID. It also picks up the Part B deductible and Part A deductible, depending on which plan you enroll in. There is limited benefit for costs for foreign travel emergency care. I would tell you the benefit is rather limited, and I would still advise you to pick up a health care plan for the duration of the trip that you have outside of the United States. And provider charges above Medicare approved amounts, which is called excess charges, are picked up by the supplement. What it does not offer or pay for is, again, the drug benefit, routine dental, vision, and hearing, glasses, custodial care, and long-term care. Those are not covered by the Medigap policy. Some fun facts, or fast facts, let me put it that way, I apologize. You must be enrolled in both Medicare A and B and live in the state where the plan is offered. There's no medical underwriting up to 6 months after enrolling in a Part B at age 65 or older. This is really important. You don't want that 6 months to come and go and not pick up a supplement if that's what you want, because after 6 months, you will now be open to being medically underwritten and your plan may cost you more. The coverage is nationwide and there's no provider network. It's guaranteed renewable as long as you pay your premium. Plan premiums may vary for the same coverage by the private insurance company. Plans with more coverage generally have a higher premium. And again, you must continue to pay your Part B premium to Medicare. What does Medicare cost? Again, I talked about the IRMMA, the income related monthly adjusted amount, which I would tell you to check into at medicare.gov. That premium is a fixed amount that you pay for coverage, usually monthly, and annually it is adjusted. A deductible is an amount that you pay for coverage, covered services before the plan begins to pay. For example, if you're on original Medicare and you do not have a Medigap or supplement plan in place, Medicare covers everything but a $1,500 deductible, which would be your obligation. Copays are a fixed amount you pay at the time of service, and co-insurance is a percentage, like 80-20. Typically, Medicare under the Part B benefits will cover 80% of Medicare eligible benefits, and you're going to pay 20%. So again, that's an exposure you have if you do not put a Medicare supplement plan in place and you stay with original Medicare. Okay, so Part C, Part D, and Medigap cost. So this is just a high-level overview of what it's going to cost you. So with a Medicare Advantage plan, they have 0 monthly premiums on some plans. Typically, those are HMO plans, but there are some PPO plans out there that are 0 premium as well. You will have deductibles and copay and co-insurances with a Medicare Advantage plan. With the Part D, which is the prescription drug program, you will have a monthly premium. This plan too has deductibles, copays, and co-insurances depending on where your medication falls within the formulary. A Medicare supplement plan will have a monthly premium. There may or may not be deductibles and co-insurances depending on which plan you select. And it's important to know with the Medicare Advantage plan that there is an annual out-of-pocket maximum for covered services. So when we talk about an annual out-of-pocket maximum for covered services, that would be for services under A, which is hospitalization, and B, which is doctor visit outpatient services. Once that annual maximum out-of-pocket is met, whether it's in network or in and out of network, then you would no longer be paying any deductible copays or co-insurances for the remainder of the year. So the annual maximum out-of-pocket is tied to the Medicare Advantage plan only. How do I choose? Okay, we're back to this option 1 or option 2. Again, you need to decide whether or not you want to have the flexibility to see any doctor, any provider across all 50 states. If you want that flexibility, I would tell you to stay with original Medicare and add the Medicare supplement program to complement original Medicare and then the Part D. If you are someone that would like to save money in regards to the monthly premiums that you pay and are willing to work within the network, then having a Medicare Advantage plan is an option for you. And it will bring you some additional benefits. For example, the drug plan can be embedded and you will get some dental, vision, and other benefits that come under the Medicare Advantage plan that is not offered by original Medicare. So again, Medicare versus a Medicare Advantage plan versus a Medigap policy. So again, it's just contrasting the differences between the two. Just to share with you again that, cost is a factor. The Medigap policy, which is going to complement original Medicare, is going to have a monthly plan premium. Those are going to be higher in premium than a Medicare Advantage plan. You have to add the drug benefit because it's not offered by Medicare. And it offers you the convenience in that there's multiple plans you can pick from when it comes to a Medigap policy. You can pick a G, you can pick an N. There's a number of different options depending on what your needs are. Under the Advantage plan, again, it is a network environment. And using in-network providers is going to deliver you the lowest cost on your services. They may or may not charge a premium. Often no additional premium for drug coverage because it's embedded in the plan. Copays or co-insurances for most covered services. And again, there is a limit to your financial exposure for services under NV. That's called an annual out-of-pocket maximum. And with the Medicare Advantage plan, it's an all-in-one plan. When can I enroll? This is called your initial enrollment period. So 3 months before your 65th birthday, your 65th birthday month, and 3 months after is when you can enroll in Original Medicare. So you'll be enrolling automatically if you receive Social Security or Railroad Retirement Board benefits at age 65. So if you start drawing these benefits, then you will receive your card typically 3 months before your 65th birthday. If you are not drawing Social Security benefits or RRB, then you must enroll yourself by going to the ssa.gov/Medicare to enroll online, or you can call or you can visit one of your local Social Security offices. So once you're enrolled in Medicare Part A and Part B, you can enroll in a Medicare Advantage plan, you can enroll in a Part D, and you can also enroll in a Medicare supplement or Medigap policy, depending on which way you decide to go, whether it's option 1 or option 2. I would highly recommend that you enroll early to avoid gaps in coverage and incurring late enrollment penalties. May refuse or delay enrollment in Part B with credible employer coverage. Again, if you are in an employer coverage plan that is a high deductible with an HSA, you do not want to enroll in Part A or Part B. All right, general enrollment period. That's for those who missed their initial enrollment period. You make the request between January through March, and then you can select a Part C or D for effective date of July 1st. So you may enroll in Part A or Part B or both. You may choose to enroll in a Medicare Advantage plan or a prescription drug plan. And if you enroll during the general enrollment period, typically there's going to be a late enrollment penalty that's going to be assessed by Medicare, because basically this indicates that you missed the 3 months before, the month of, and 3 months after of your 65th birthday. So be aware of that. Medicare supplement open enrollment. Again, this has to do with when you come on to Medicare with Part A and Part B. You have 6 months, and it begins with the month in which you turn 65 or older and enroll in Medicare A and B. There's no medical underwriting if you enroll during this time. And the reason why this is important is because if you have a chronic disease or an illness and you don't do it during this guaranteed issue period, and you wait sometime down the road, when you go to enroll, you will have medical underwriting and your premium will be significantly higher. So keep that in mind. Special enrollment period, if you're working past age 65, let's say you're working and you're not going to retire till age 68, 69, then you have 8 months in which to put Part A and Part B in place. It's the last month of employment or employee health coverage to put Part A and Part B in place. And then that also coincides with selecting a Medicare Advantage plan or putting in place a Part D. So late enrollment penalties can apply if you miss your enrollment period. For Part A, none if you qualify for premiums at no cost. If you did not meet the requirements that Medicare has in place, then the penalty is going to be 10% of the Part A premium. That's going to be considered a late enrollment penalty. For Part B, none if you qualify for what's called a special election period. If you don't qualify for that, then there's a penalty that is 10% of the monthly premium for the Part B. And that amount for each full 12 months of period enrollment is delayed. So be aware that that's how that works. For Part D, there's none if less than 63 days expire without credible coverage. So if you have employer coverage and then you separate and you don't put something in place that includes prescription and it's past 63 days, then there's going to be a 1% penalty that's going to be added to your Part D premium for each month that you delayed your enrollment. And all of these qualifiers here that are listed can be found at medicare.gov. So feel free to visit that website. And when can I change my coverage? Again, I told you we're going into the Medicare annual enrollment period for those that already have Medicare and are enrolled in a plan as of this current year. Between October 15th and December 7th is the annual enrollment period for those folks. So you can switch or drop a Medicare Advantage plan or a prescription drug plan. You can switch from original Medicare A and B to a Medicare Advantage plan and vice versa. You can switch from one Medicare Advantage plan to another, and you can apply for a Medicare supplement insurance plan during this period for effective date of January 1st. Okay, Medicare Advantage open enrollment period. This is only for folks that select a Medicare Advantage plan or are on a Medicare Advantage plan. It's from January 1st to March 31st. And basically what you're doing is switching from one Medicare Advantage plan to another, or returning back to original Medicare. And if you return back to original Medicare, then you will be allowed to enroll in a prescription drug plan. And it's only allowing one change during this time. Special enrollment periods, typically it's the month that you qualify and 2 months after. And typically it's for folks that may be moving, maybe you move from Indiana to Florida, then you have what's called a special enrollment period due to that move. If you're leaving a retiree, union, or COBRA coverage, you will have a special election period. How can I save money? So be wise, use benefits wisely, both with original Medicare and an Advantage plan. They offer many preventative services that come to you at no cost. Use your plan's provider network. This is true with original Medicare, in that you want to utilize providers that are willing to file with Medicare, and with the Advantage plan, many of them do have network providers that will deliver services at a lower cost. When you're visiting with your provider, ask for generics or lower tier prescription drugs so that you can conserve that annual benefit and not get into what's called the gap or the donut hole. Mail order helps. And more importantly, understand your status in the hospital, especially when you're enrolled under original Medicare with a supplement, that you're understanding whether you're an admitted patient or being observed, because the benefits for Medicare will work differently. All right. This is just additional information for you in regards to if you feel that you qualify for extra help with your Part D cost, that's prescription cost. You can learn about that. State and federal provides benefits under Medicaid, which is different from Medicare. It provides healthcare coverage for people and families with limited income, and programs do vary by state. A Medicare savings program helps pay Medicare Part A and B cost. That's a type of Medicare Advantage plan that's offered. And then programs of all-inclusive care for the elderly called a PACE. Providers provided services for frail individuals living in the community. For the state, it's called a SHIP office, And this is run by the state, and you could call and they can provide you support in making a decision. If you want to work with someone that's impartial, you can feel free to reach out to them. Where can I go for help? I would tell you to, you can visit MedicareMadeClear.com. That's a United Healthcare portal that will provide you information. But I would tell you, more importantly, you should go to Medicare.gov. That is ran by our federal government. There's lots of great information there. You can also call 1-800-Medicare if you don't have access to the internet or you're not comfortable there. And you can contact your Social Security office or your state Medicaid offices. They're all there to support you. I also want to share with you that, again, here at Storen Financial, I am here to advise those folks that are moving into the Medicare arena. Our consultation comes to you at no cost. All you need to do is call the local office, and they will forward the information to me, and then we will schedule a one-on-one appointment. Again, if you want to talk about long-term care, there is an advisor here at Storen Financial that can assist you with that. That's for care once you become or having needs for long-term care because of your health, because Medicare only covers long-term care, and the Advantage Plan only covers long-term care for a limited amount of time, and it's exclusively for rehabilitation. So again, thank you for joining us. If you have any questions, I believe this presentation is going to be posted on our website at Storen Financial. My name is Ruth Hoffman, and you can call the office here and they can certainly get your information to me. And it would be my pleasure to have a more profound discussion with you about what your needs are for healthcare once you move to Medicare. So again, thank you and have a great day.